Hello, I'm Susan Summers. I'm with the International Network for the Prevention of Elder Abuse, and I'm pleased to be speaking with you today in Prague. However, sad that it's virtual. Would rather be in beautiful Prague together with you, perhaps next year. We're going to talk about elements of elder abuse, defining human rights to adequately address violence, abuse, and neglect of older persons. And we know that in all regions of the world, the pandemic has revealed that older persons were more affected by the pandemic than any other age group. They were sicker when they were infected, they encountered more short and long-term severe health conditions, and at a higher rate. The response to the pandemic varied across states and countries, but most prevention and safety measures that were put in place were afterwards seen as potentially abusive. The lockdown and the resulting social isolation, lack of in-home support care for personal hygiene, feeding, and hydration, postponed medical procedures and palliative care measures at the end of life, older persons and their families were deprived of critically important personal contact. These conditions were finally acknowledged as elder abuse, visually and emotionally capturing the attention of the public, and significantly, the politicians. For example, in April 2020, the Quebec Premier first talked for the first time of organizational neglect, and when commenting on a series of dramatic deaths in prominent care institutions. This crisis in a crisis, as declared by Professor Boulay, elder abuse during the pandemic provided a timely opportunity to highlight abuse of older persons and raise it to a higher level on the political agenda. Just as Canada is also embarking on research to find ways to improve data collection on elder abuse and develop legal definitions possible to put in the criminal law. But more about this in the coming months. As men and women age differently, a gender lens is critical to understanding their experiences from a life course perspective. We can no longer talk about elder abuse in older persons without acknowledging the nuances of gender in connection with an intersectional view of age, race, and ethnicity, ability, etc. Since the onset of the pandemic, MPEA has been holding bi-monthly virtual meetings with actors from all regions, discussing the links between the pandemic and the abuses of older persons using a gendered lens. The lessons learned amplifies our understanding of definitions of elder abuse, utilizing a human rights lens in time of pandemic to move forward on a national, regional, or global agenda. A little background is the definition that we all know of elder abuse and have used for many years from the Toronto Declaration on Elder Abuse. Elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there's an expectation of trust, which causes harm or distress to an older person. And it can be of various forms: physical, psychological, emotional, sexual abuse, financial, or simply reflect intentional or unintentional neglect. This abbreviated definition in the Toronto Declaration and the expanded definition presented in the World Health Organization Report on Violence in 2002, Chapter 5, still focuses on specific acts associated with elder abuse and neglect. These are well known as physical, psychological, financial neglect, with settings in which abuse may be perpetrated, for example, in the home or institutional-like care. The expanded definition in Chapter 5 looks at systemic abuse, for an example, of residential care facilities that do not target a specific individual, but may more broadly harm individuals incidentally through insensitive routines that serve the convenience of the institution and staff to the detriment of the specific residents. Missing are broad systemic abuses linked to ageism, gender discrimination, and importantly, the cumulative effect of life course disadvantages like poverty and social exclusion, and the need for remedies to these social inequities and ills. These require a human rights approach to understand and address them. And in fact, the human rights perspective is an emergent one in relation to elder abuse and neglect. The human rights perspective is emerging in relation to elder abuse and neglect. Let's look at examples of global efforts to address gaps in the normative framework, defining violations of the human rights of older persons. Elder abuse is a violation of human rights. It's not a new phenomenon. It's an age-old problem and one of the last taboos. According to the World Health Organization, estimates of 1 in 6 people aged over 60 suffer abuse. This means nearly 141 million people globally, and this number might be much higher as violence, abuse, and neglect of older persons are the most hidden and underreported violations of human rights. The UN Secretary General, in his 2020 policy brief, The Impact of COVID-19 on Older Persons, claimed that the lack of adequate national legislation to protect the rights of older persons and the absence of a dedicated internationally agreed legal framework, i.e. a convention, may have contributed to the inadequate responses to the COVID-19 crisis, and that these gaps must be filled. In her first General Assembly report, the United Nations independent expert on the enjoyment of all human rights of older persons highlighted the inadequate legal framework governing rights to health, adequate standard of living, palliative care, and age discrimination. This is an example of expanding the definition of elder abuse based upon a human rights framework. And on the regional level, the Inter-American Convention on the Protection of the Human Rights of Older Persons, which was enacted passed on the 15th of June 2015, World Elder Abuse Awareness Day, the OAS became the first intergovernmental organization to adopt a legally binding instrument in this manner. Thus, a new framework of rights for older persons was implemented in the Latin American states. One of the main aspects of the convention is that it corrected an omission made by the international law on human rights about older persons, thus generating a series of standards and important guarantees that no other internationally binding instrument had explicitly considered before, such as the right to life, dignity in old age, and the right to independence, autonomy, and participation, amongst others. And that is from the ambassador, the director of the human rights of the Ministry of Foreign Affairs of Chile. The CRPD also mentions palliative care, some new issue. And we know it's the obligation of all states to respect, protect, and fulfill all human rights and fundamental freedoms, as found in the rich tapestry of the Charter of the United Nations, the Universal Declaration of Human Rights, the International Covenants, the Convention on the Elimination of All Forms of Discrimination against Women, where for the first time age discrimination was prohibited in the workplace, the Convention on the Rights of Persons with Disability, and the International Convention on the Elimination of All Forms of Racial Discrimination. Some soft laws are the Political Declaration and the Madrid International Plan of Action on Aging, the UN Principles for Older Persons are guiding, and the 2030 Agenda for Sustainable Development, which stresses the need to ensure that no one is left behind, including older persons, and recognizing the essential contribution that they, older persons, make to the functioning of societies and to the achievement of the 2030 Agenda. As we have experienced, older persons have been disproportionately affected by COVID-19 pandemic, which in addition to high morbidity and mortality, has exacerbated pre-existing inequalities, discrimination, and stereotyping, including hate speech. Ageism compounds other forms of inequalities based on gender, disability, and health status, ethnic origin, indigenous identity or migrant status, gender identity, and sexual orientation, social economic status, and other grounds, and affects opportunities to participate in society. And this is coming from the independent experts report at page 51. Older women who outnumber older men often face multiple cumulative and intersecting forms of discrimination or can be victims of violence compounded by their gender, age, or disability, or on other grounds, which affect the enjoyment of their human rights. And fundamental to a human rights approach to the enjoyment of human rights by older persons is the protection and promotion of the right to dignity, autonomy, and independence. And in seeking this, states should provide a range of support services that provide the dignity, autonomy, and independence of older persons with due regard to their individual preferences. States should recognize that human rights are necessary preconditions to cross-cutting rights, such as access to justice, social security, education, etc., and including the areas of prevention and protection against violence, abuse, and neglect, social protection and social security, equality and non-discrimination, new technologies, healthcare, work and access to the labor market, long-term support and palliative care, and then very important, social inclusion. Critically important is that states work at the local level on national legislation and actively participate at the global level with the open-ended working group on aging to develop internationally agreed upon standards and human rights-based elements of elder abuse, which address, amongst the following other things, possible elements to prohibit all forms of discrimination against older persons, adopt and implement non-discriminatory policies, strategies, action plans, laws, and regulations, promote and ensure the full realization of all human rights and fundamental freedoms for older persons, and systematically provide for the consultation and participation of older persons themselves, their associations, and organizations that represent them. Very exciting news today is more than one, there's several things that are happening. The independent expert on the human rights of older person is giving her report today at the 48th session of the Human Rights Council at the same time that we're meeting here. But you can watch the archive that'll be on the UN website. And further, states, a core group of states, to protect the human rights of older persons are proposing a resolution to the Human Rights Council, encouraging all states to take measures to prevent ageism and age discrimination and to protect the human rights of older persons in the area, and particularly in prevention of and protection against violence, abuse, and neglect. We know that ageism is associated with stereotypes, prejudice, or discriminatory actions and practices, and including hate speech against older persons, which we've seen during the pandemic. We call upon all stakeholders to eliminate ageism and age discrimination in all its forms, adopt a human rights-based approach in all programs, campaigns, and activities, and to identify and integrate the needs and meaningful participation of older persons and their organizations in preparing things such as disaster risk reduction acts and ensure emergency plans and responses include them. We need effective redress mechanisms to ensure access to justice on an equal basis, and that they're accessible and age-sensitive legal proceedings that older persons can access. States need to collect and analyze data disaggregated by age, gender, disability, and other relevant criteria, because otherwise we can't identify and render visible inequalities and structural aspects of discrimination. States should consider the United Nations High Commissioner for Human Rights analytical update report on the normative standards in the international law in relations to older persons. This will help them as they examine the inadequacy of the international human rights system, and to develop standards and elements for protecting the human rights of older persons. Extremely important today is the release of an open letter to the General Assembly of the Open-Ended Working Group on Aging for the purpose of strengthening and protecting the human rights of older persons. We call upon members and states to support the chair's proposal made by Argentina in the 11th session to establish an intersessional group to advance the work, but more importantly, to be tasked to commence the drafting of the main normative elements of an international legal instrument during the intersessional period. The time for a new convention is now. There's no waiting. Enough harm has happened. And so now it is my pleasure to turn over to my colleague, Alice Casagrande, to share France's experience developing national human rights-based laws against violence, abuse, and neglect. Thank you.